Good morning everyone. Myself Dr. Nidhi Shukla, Assistant Professor from Faculty of Paramedical Sciences, Rama University, Kanpur. So today my lecture is anterior cruciate ligamental injury. It is also known as the ACL injury. So firstly I am discussing about the introduction of ACL injury. So the ACL injury is most common injury of the knee because it is a weight bearing joint and the ACL is a resistance of the transverse lobe or the anterior portion and the anterior cords. So it is most common injury of the sports pupils, those who are playing the vigorous activity like a football, rugby, runners, basketball, jumpers, high wrestling and also in the lower skiing. So in these type of vigorous sports, the ACL is a more prone injured ligament because this is the weight bearing joint. It is presented the anterior side and also created an anterior translation load, and it is a prevention of the anterior translation load. And in the number of sports, there is more vigorous activity and the more power that is translated in the anterior side. So that's why it is a more common injury in the vigorous sports. Another way, when I am talking the normal population, it is most common in the women's, those who are actively participation in the number of sports and number of doing vigorous activity like running and the marathon runners, and like who are the higher ranges of the like normal population in the older pupils, in the older women, it is most common injury. So about the age of 50 to 70 year of age, it is most common in the women's and less common in the males. So the ratio is the male and the female is females, that is the male is ratio is 1 and the females is ratio is the 5. Why? Because of a number of anatomical anomalies of the females like a wider pelvic, like smaller intercondylar plateau and tibial plateau, there is an insertion of the ACL ligament, and in the time of the rotational and the jumping activity, there is a more prone of the anterior ligament that is easily torn and easily injured. So that's why it is a more common in the females than the males. But also the recreational sports is the more common injury of the ACL injury. That's why number of physical activity, number of the physiotherapy management and the management of the surgical intervention, it's most common. This is also most common in the military trainers and soldiers. Why? Because they are doing a number of rigorous activity, jumping, landing, skiing and number of sports that they are participating. So that's why it is a more prone injury because of the turning and external rotation of the knee, easily torn of the ACL and the medial meniscus. That's why it is a more common. So firstly, the introduction about the ACL injury, it is most common in the vigorous sports like a football, basketball, rugby, wrestling and the lower skiing and also the climber, and it is most common in the females, those who are creating a number of vigorous activity and doing the number of vigorous activity. And after the older population, the females is more prone to ACL injury than the males. So the ratio is the 1:5. So now the clinical anatomy of the ACL injury. So you are seeing, this is the picture of the ACL. There is the femur, there is the condyles, is the lateral condyle and the medial condyle of the ACL. There is the fibula and the tibia. In between the femur and the tibia and the fibula, there is a presented the synovial fluid and the synovial membrane, and here the 11 ligament is presented in the knee joint that is supporting and stabilizing the knee when we are doing the activity, and these are the ligament that providing the support of the knee and also resistant the force in the number of and vigorous direction in the number of direction in the force. So firstly, the ACL is known as the anterior cruciate ligament. There is the presented is behind the one of the ligament, that is the PCL ligament, that is known as the posterior cruciate ligament. In below there is presented the lateral meniscus and the medial meniscus. The menisci that is resistant the load of the when we are doing the jumping activity. So it is translating the load and the resistance the load, and also the ligaments that is providing the support of the knee joint. There is the lateral on the medial side, there is the MCL, lateral side is the LCL ligament, that is the lateral collateral ligament, and the medial side there is a presented of the MCL ligament, that is known as the medial collateral ligament. So I am talking about the ACL. So the anterior cruciate ligament, there is the origin of the posterior medial corner of the medial aspect of the lateral femoral condyle, the intercondylar notch. So origin at the side of the lateral side of the lateral condyle, and it is coming in the medial side of the insertion is the intercondylar eminence of the tibia in the medial side. This is presented in the anterior, medial and also the inferior side of the knee joint. So origin is the posterior medial corner of the medial aspect of the lateral femoral condyle in the intercondylar notch, and there is the insertion is the intercondylar eminence of the tibia, medial side of the tibia. So this is these are the ligaments that is preventing the anterior translation load when we are doing the extension activity and the flexion activity. So the ligaments is taut and ligament is relaxed position. So the ACL ligament, there is a component of the ACL ligament, that is the AMB, that is the anterior medial band, and the PLB, that is the posterior lateral band. Two condyles, two components of the ACL ligament. First is the anterior medial band. This is presented in the anterior side, medial side, and preventing the anterior translation force. And the PLB is the posterior lateral band. This is the component of the ACL. So the PLB is the posterior lateral band that is presented in behind the anterior medial band, and there is a bone in the lateral side of the ACL ligament. So there is a two component of the ACL ligament, anterior medial band and the posterior lateral band. Okay, now when we are doing the extension of the knee joint, so the anterior medial band is in the shortened position and the posterior lateral band is in the lengthened position. When we are doing the some of the flex activity, so the posterior lateral band is in the shortened position and the anterior medial band gone in the lengthening position. Okay, so when we are doing the kick activity, the footballers that is doing the cutting crossing training and the cutting and kicking the football. So when the athletes is gone in the extension activity, hyper extension activity or the extension activity, so the posterior lateral band is in the lengthening position and that is taut at the time when they are completely in the extended position of the knee joint. So posterior lateral band is taut. So the posterior lateral band, when the taut, this band is easily torn because at the time the PLB is in the tautened position. Okay, so there is easily torn, and the AMB is torn easily when we are doing the flexed activity, and sudden rotation will be occurred. So the AMB is easily torn. So there is the two component AMB and the PLB. AMB is shortened when the we are doing the extension activity, and the PLB is lengthening when we are doing the extension activity. Okay. Now the next point we are discussing about the functions of the ACL. What is the function of ACL? So this is there is a more functioning time when we are doing any type of vigorous activity. So the anterior cruciate ligament is preventing the translation of the anterior side. So first function of the anterior cruciate ligament is the anterior tibial displacement. This ACL ligament is resist the force of the anterior side when we are doing the extension, fully extension in the flexion activity. So if the anterior translation will be occurred in the posterior side, at the side of the posterior, so this ligament is resist the force, and not easily torn and not easily displace the knee joint. So first function is the anterior tibial displacement. Second function of the ACL ligament is the tibial rotation and the varus force. When the tibia is rotated over the femur, so the AMB or AMB band is the anterior medial band is in the taut-in position. Okay, so if the resistance will be occurred or the force will be occurred in the posterior side, so this ligament is easily in the lax position and easily it will be tear. So it will resist in the tibial rotation and exercise of the varus force. Next is the third function of the ACL ligament is the proprioceptive function. What is the proprioceptive function? When we are standing and the joint receptors will be active. So this is the proprioceptive functioning activity when joint receptors is active, when compression of the joint and receptors is active, so neuromuscular transmission is easily go through in the brain. So ACL is also providing the proprioceptive functioning activity. If the ACL ligament is tear, so the proprioceptive activity is also decreased. So because of the person is not loading in the knee joint, so that's why it is a main function of the ACL, that is a proprioceptive function. So three main function is the anterior cruciate ligament. Is first one is the anterior tibial displacement, resistance force of the anterior side of the displacement. Second is the tibial rotation and the varus force. It will be resist the rotational force and the varus force. And the third one is the proprioceptive function. This is a most important function because of the joint receptors is active. So the positioning of the knee joint is uniform. If the joint receptors is inactive or the ligament is tear, so the proprioceptive functioning is deteriorate. Okay, so this is the main important function, the third function. So I am discussing about the introduction about the ACL, clinical anatomy, where is the insertion point, where is the origin point of the ACL and the function of the ACL. Now the mode of injury. What is the mechanism of injury or the mode of injury when the ACL is torn? So first is the direct impaction of the ACL. When the opponent player, when the athlete is playing on the ground and playing the vigorous activity and playing any type of sports, so opponent player is directly kick at the side of the knee in the posterior side, or foot or the feet is going in the hyperextended position. So the ligament is easily torn. Which of the component is the PLB, is the posterior lateral band, when foot is going in the hyperextended activity. Okay, now directly impaction at the side of the ACL or the posterior side or the anterior side of the ACL. So the ACL is easily torn. It is activated in the when we are doing playing any type of sports, when we are doing a vigorous activity, when athletes is on the ground and playing the number of sports like football, basketball, rugby and number of sports. So when the opponent player is impact at the side of the ACL, or the component or the number of playing equipment like football, like hockey is directly impact at the site of the knee, there is the origin or insertion point of ACL or the midpoint of the ACL. So ACL is easily torn. So this is the direct injury. Indirect injury, what is the indirect injury? When the tibia is rotated, is in the medial side, tibia is rotated over the femur and the ligament goes in the hyperextension position. So the ACL ligament is easily torn. Or if the tibia is rotated on the external side and the foot is gone in the flex position, so the ACL is easily torn. So this is the indirect injury. Indirect injury will be occurred when at the type of jumping activity, or when we are through on the ground and the uneven surface, so foot is gone in the internal rotation or the hyper extended position, or if we are kicking the ball, so the cutting crossing training, so when the foot is gone in the internal side or the external side, so easily ligament will be torn. Okay, so this is the indirect injury. Okay, so the mechanism is tibia is rotated in the external side or foot is gone in the extended position, hyper extended position, so the ligament is easily torn. Then in the non-contact injury is a number of non-contact injury when not even a number of component of the sports component or the surface ground is not even match. Non-contact injury is occurred in the older population, like a older woman, easily there is presented in the malpositioning of the bone, and the surface of the bone is gone, and also the osteoporosis will be occurred, so the ligament laxity will be occurred also. So the ligament is easily getting torn, the foot is gone in the hyper extended position or tibia is rotated, so there is the injury will occur. Okay, so the three type of the mechanism of injury is the direct, indirect and non-contact. Direct or indirect injury, direct injury is also occurred in the sports, and indirect injury will also occur in the sports or number of vigorous activity when we are doing, and non-contact injury is occurred in the older population also. Okay, now so one point is mode of injury and the mechanism of injury. Is the woman more prone to the injury? Why? Number of factors and the anatomical factors will be occurred when the women are more prone to the ACL injury. Is first is a smaller size in the different shape of the intercondylar notch. Smaller size. The tibia and the fibula is the smaller, and the intercondylar notch is also smaller. So the ligament is not intact properly at the site of the intercondylar area, so that is easily torn, the exertion force will be occurred and easily the ligament is torn. So first is point that is the woman prone to the injury is first is a smaller size in the different shape of the intercondylar notch. Second point is the wider pelvic. So this is example of the Q angle. The wider pelvic of the women's, that is the Q angle is increased or decrease also, the Q angle is increased. So knee is gone in the knock knee position. Okay, and also the ligament is getting stressed position also all the time of the stretch position. Smaller impaction occurred and the ligament is torn. So this is a smaller example. Third point is the greater ligament laxity. Why greater ligament laxity? At the time of the older age, the menopause will be occur in the women's in the older age, and the osteoporosis will be occur. So ligament laxity will be occur if the present is the osteoporosis and the osteoarthritis in the women's. So the ligament laxity is easily, so ligament is easily getting torn. Next is the shoe surface interference. Shoe surface interference, it is much more important in the athlete and the woman athlete. Shoe surface, number of sports is a different type of shoes, like runners is runner shoes, footballers the studs type of shoes, and the basketball is the spike type of shoes. So if the shoe surface is too much smaller and easily getting friction created, the friction, and the sole is not in the proper way, so so the biomechanics will be impacted at the site of the knee and the ligament is easily getting torn. Next is the neuromuscular factor. Neuromuscular factor, is it important the proprioceptive function? If the neuromuscular factors, if the proprioceptive activity is not in the properly functioning at the time when we are doing any kind of training or any kind of activity, so ligament laxity will also occur and the positioning of the joint is not in the corrected position. So ligament is easily gone in the lateral position and the medial position. The joint specific position is not known, and knee is gone in the internally rotated position. So ligament is getting stressed position and ligament is getting torn. Next is the dynamic position of the knee. In the women's when they are playing any kind of sports, so the foot is impact on the ground, so there is the impaction, the gait cycle is not proper way, so the foot is gone in the internally rotated position because of the wider pelvic, because of the Q angle is increased, so the foot is not impacted at the site of the ground in the proper way, so ligament is getting in the stretch position and ligament is getting easily torn. So number of points that the woman is prone to the injury is, first is the smaller size, the different shape of the IC in the intercondylar notch, wider pelvic, greater ligament laxity, shoe surface interferences, neuromuscular factor and the dynamic position of the knee. So this is the mode of injury and the mechanism of injury of the anterior cruciate ligamental injury. Next is the risk factor. Number of risk factor will be occurred of the ACL injury. The first one is the internal risk factor. Internal risk factor is the inner factor. First is the anatomical position. Anatomical anomalies. Congenital deformity. In the women's, the Q angle is increased, wider pelvic, smaller intercondylar notch or intercondylar area, or ligament laxity will be occurred because of the congenital anomalies. So there is the easily and the ligament is getting a stretched position. And second is the hormonal deficiency. In the women's after the menopausal age, hormonal disturbances will also occur. Also in the men's, but women's is more prone for the hormonal disturbances. So at the time of the hormonal disturbances, the tendon and the ligament is also laxed position, and the fluid is also decreased at the site of the joint cavity. So the laxity will be occurred at the site of the ligaments, so ligaments is easily getting torn. Next is the internal factor is the neuromuscular position. Neuromuscular position is the joint position. Also the proprioceptive function is lax, so that's why proprioceptive functioning is lax, because of the joint is easily getting is the like the when the synovial fluid is decreased and the joint getting fused at the site of the position, so the neuromuscular facilitation is also lax. That's why the functioning, that was the tautening of the ligament, and when the ligament is in the taut position, so it is easily getting torn or stretched position. Okay. So number of risk factor of the internal risk factor, first one is the anatomical anomalies, second one is the hormonal disturbances, and the third one is the neuromuscular position. Next is the external risk factor, is the outer factor of the ACL. External risk factor, first one is the type of the competition. Type of the competition is like a vigorous activity, is the international national competition, that time of the vigorous activity will be occurred, and the cutting crossing training is also in the more prone at the site of the competition. So depending upon the type of competition is the higher level or in the lower level. So if the higher level of the competition, there is the vigorous training, there is the vigorous activity will also positioning of the athlete and continue training given to the athletes. So that's why the athlete is getting in the domestic, and also the domes will be occurred in the muscles. So that's why the ligament is also getting a stressed position and easily getting torn. Type of contraction is the vigorous and the normal. Vigorous competition, the ligament is getting easily stretched position because of the vigorous activity will be occurred at the site of the ground. Next is the footwear and the surface. If the footwear is too tight or too loose, or if the footwear is in not proper position, proper in the shape, so that's why the biomechanics is also decreased, biomechanical angle is also decreased, so the impaction of the ground of the foot is also in improper way. So that's why if the internally rotation will be occurred more prone, and the hyperextension of the knee is also in the improper way. So that's why the ligament is easily prone to the injured position. And the surface, if the uneven surface or very firm surface of the ground. So that's why the positioning of the foot is also decomposed, and that's why the ligament is getting easily stretched position and the ligament is getting easily torn. Next is the environmental condition, very much humid condition and very much cold environment. So that's why the athletes is also decreasing. There is the laxity of the water and the hydro that's why. So the athletes is getting fatigue at the time and the ligament laxity will be occurred because of the positioning of the joint. Simple. So there is the external risk factors, number of external risk factor, but there is a three main external risk factor. First one is the type of the competition, is a vigorous, very vigorous type of competition. That is the footwear and the surface. Footwear is too tight, too loose and not kind of the sports, and the surface is uneven and the normal surface. Next is the environmental condition, is too humid and too cold condition. So normally getting stretch position of the ACL. So this is the risk factor, internal and external. Now I am coming to the biomechanics of the injury. Biomechanics is also important. If the windlass mechanism we are follow, there is the ankle position, there is the knee position and the hip position. If the ankle position is deformed, like foot is in the internally rotated, so if the foot is in the internal rotation, the knee is also in the medial position and the hip is gone in the medially rotated. If we are talking, the footwear is in the internal position in the plantar flexion, so the anterior cruciate, so the ATTFL injury is also common, and the ACL injury is also common because of the hyperextension of the foot and the medially rotation of the tibia. So the ACL is in the stressed position, so the ligament is torn. First is the windlass mechanism, is follow the lower to upper extremity. Now when we are following the Q angle, if the wider pelvic Q angle is decreased, so knee is in the internally rotated position and is in the internal position, and the foot is gone in the outerward position. So ligament is stretched position, MCL is getting in the stretch position. So ligament, ACL ligament is easily getting torn at the site of the injury. Okay. So the biomechanics of the injury is most important, because if the biomechanics of the foot is getting in improper way, is like foot is in the internally rotated or externally rotated, so knee is getting in the abnormal position, so ligament is getting in the stretch position when we are doing any kind, when we are standing, when we are doing any kind of vigorous activity or playing surface. So ligament is in the stretch position or ligament is easily getting torn in the smaller external force. Okay. Now the grades of injury. We are the ligamental injury or the tendon injury, where the degree of the grades of the injury is in the three, like the first grade, second grade and also the third grade of injury. The first grade of the ligamental injury is the smaller tearing occurred, smaller swelling, and athlete or the player is not give up at the side when they are playing. Smaller swelling, smaller sudden popping sound is hearing. So grade 1 injury is some of the fiber is tear or the one fiber is tear. So this is occurring in the grade 1 injury. Small inflammation sign is seen at the site of the injury. Then the second grade of injury is the partial rupture of the ligament. Partial rupture is a sum of the fiber is tear, sudden give up the activity when the athlete is any time of activity that they are doing. At the time is given, higher inflammatory sign will be occurred if the grade 2 injury will be occurred, and the give up of the way is athlete. Third grade of injury is the complete fiber rupture of the ligament, huge swelling, give up, and pain is vigorous pain and also the less pain is occurred at the site of the injury. So there is the grading of injury is 1, 2 and 3. Now the clinical presentation in number of conditions. Pain, inflammatory sign is presented, that is the pain, swelling, popping, snapping sound is presented, the giving way, pain is huge, swelling will be occurred at site of the injury, and number of inflammatory symptoms is seen at the site of the injury. Okay. Now the associated injury, number of associated injury will occur in the ACL, like a medial meniscal injury, fracture is the condylar fracture, is the avulsion fracture, and also the cystic fracture will be associated of the injury. The most common associated injury of the ACL is the medial meniscal injury. Why? Because of in the insertion point, at the site of the intercondylar eminence, the ligament is attached to the medial meniscus. If the ligament is in the stretch position, so the medial meniscus is also torn. So the associated injury is most prone the medial meniscus with the ACL injury. Okay. Now the differential diagnosis or the differential procedure. Number of same sign and symptoms is same in the different type of injury, like a fracture, avulsion fracture, like a medial meniscus injury, like a lateral meniscus injury, like a MCL, like a LCL. Okay. And the lateral menisci injury will also be similar. So differential diagnostic procedure is different, and the DD is similar to that type: fracture, avulsion fracture, medial ligamental injury, lateral ligamental injury, medial meniscus injury, lateral meniscus injury. There is the differential diagnosis. The diagnostic process is number of physical examination, physical assessment, imagining procedure, and like orthoscopy. Number of diagnostic procedure we are done. Firstly, the physical examination. We are follow the assessment protocol like demographic examination, and the number of procedure will be done. Main is the special test. In the special test of the ACL injury is the first is the anterior. First one is the Latchman test, anterior drawer test, and third test is the pivot shift test. These special tests we are done in the ACL ligamental injury. So the anterior drawer test and the Latchman test is presented in the grade 1 and the grade 2 injury, and the pivot shift test is positive in the grade 3 ligamental injury. Okay, so these are the three special tests: Latchman test, anterior drawer test, and the pivot shift test. Now the examination. Examination is the imaginary examination where we are doing the X-ray, MRI, and arthroscopy, ultrasound. Okay, so in the X-ray, the AP and the lateral view are follow. MRI is clearly seen the meniscal and the ACL injury, whereas the torn will be occurred and which grades of injury will be occurred. The arthroscopy is done when the associated injury will be occurred, like the ligamental and the meniscal injury will be occurred, and the ultrasound we are done the main functioning test for the examination of the ACL injury. Last but not least, the management. The management is the main is the surgical management and the physical management or the physiotherapy management. The surgical management, the arthroscopy and the surgical intervention, ligament transfer, ligament tendon transfer, ligament transfers we are doing in the surgical management in the grade 3 injury or also the grade 2 injury. When the associated injury will be occurred, so the surgical management will be done, and the physical management or the physiotherapy management we are doing the phases wise: phase 1, phase 2, phase 3 and the phase 4. Number of different, phase 1 is the main goal is the pain management. Pain management, number of modalities we are using like ultrasound, like a TENS, that the pain will be gone. And on the ground we are using the ice therapy or cryotherapy. Okay, in the grade 1 injury. In the grade 2 and the grade 3 injury, the pain management will be done at the site on the OPD, in the OPD. Okay, number of the modalities we are using for decreasing the pain, and then and some kind of exercise, but not doing at the pain management side. In the phase 2, increasing the range of motion. So, active passive motion, movement, and the strengthening strengthening of the muscles, that is the hamstring, quadriceps and the calf muscle. We are doing the grade 2 injury when pain is decreased. In the grade 3, there is the strengthening protocol, proprioceptive and the agility training will be occurred if the pain will be gone and the range of motion will increase. After that, we are doing the agility proprioceptive training, and the balance training will also be done. In the phase 4 is also return to the sports. So, specific sports training that we are follow, like a proprioceptive training of the lower limb, like agility training, like a neuromuscular training, like a balance training. The number of different training we are following for the return to sports, cross country training and cut cross training, different type of sport, different type of training we are catch up. Okay, so let's revise. Okay, summarize. Okay, so first one is that we are discussing about the anterior cruciate ligamental injury, is the ACL injury. Introduction, it is a common in the vigorous sports like a football, basketball, runners and number of vigorous sports. Women are more prone to the injury of the ACL injury. Clinical anatomy, there is the origin of the posterior medial corner of the medial aspect of the lateral femoral condyle in the intercondylar notch, and the insertion is the intercondylar eminence of the tibia. And the component there is the AMB is the anterior medial band and the posterior lateral band. AMB is shortened when the knee is in the flex position, okay, extended position, and PLB is lengthened when the knee is in the extended position. Function of the ACL is the anterior tibial displacement. On the translation, force is resist tibial rotation in the varus and the proprioceptive function. Now, the mode of injury is direct, indirect and the non-contact. Direct, indirect is common in the sports, number of sports, and non-contact is present in the older population. Okay, women prone to the injury is the smaller side of the different, IC notch, wider pelvic, greater ligament laxity, surface interferences, neuromuscular factor, dynamic position of the knee. Now, the risk factor is the internal and external risk factor. Internal risk factor is the anatomical, hormonal and the neuromuscular, and the external risk factor is the type of the competition, there is the external footwear and the surfaces and the environmental condition. Now, I am discussing, we are discussing about the biomechanics of the injury. Biomechanisms deform, number of congenital position, number of foot anomalies. So, that is why the knee injury or the ligamental injury is more prone. The grades of injury is divided into the 3 types. First one is the smaller, some fiber will be tear. Grade 2 is the partial rupture of the ligament, and the grade 3 is the complete rupture of the ligament. Clinical presentation is inflammatory sign, popping, snapping sound present at the site of the injury, and number of inflammatory condition will be occurred at the site of the knee, and give up those doing the different training and the different activity. Associated injury is more prone, the medial meniscal injury, fracture, avulsion fracture, contusion fracture, condylar fracture. There is the associated injury with the anterior cruciate ligament. The differential diagnostic procedure, number of diagnostic procedure like a physical examination, the assessment protocol we are follow. Special test is the three kind of special test we are doing the ACL injury is the Latchman test, anterior draw test and pivot shift test. DD is the differential diagnosis, number of differential diagnosis, the fracture, MCL injury, LCL injury, plateau injury, and number of differential diagnosis. Examination is the imaginary examination we are done in the X-ray, MRI, ultrasound, CT scan and the orthoscopy also. The management is divided in the 2 types, is the surgical intervention we are done in the grade 3 injury or also the grade 2 injury is the surgical intervention is ligament ligament transfers and the ligament reconstruction, surgical intervention we are done, and the physical management we are dividing the phases by the phase 1, phase 2, phase 3 and the phase 4. Number of phases, we are doing the number of types of exercises, and we are completing rehabilitation protocol for the ACL injury. So, this is all over the anterior cruciate ligamental injury. Thank you so much.